And good morning. Welcome to Community Voice. Today is Tuesday, July 19th. I'm your host, Josh Engel, and today we are live streaming on our Facebook Live, our WLBB, on our WLBB Facebook page. So be sure to go check that out. If you have any questions or comments for our guest, feel free to type those in, and I'll be happy to read them to Andrew here. Our guest is Andrew Mills. He is the CEO of CareTrack. I think I should probably just leave it to him to really break down everything that CareTrack does, but they are a very dynamic new company that is going to generate a surge to the West Georgia professional job market, particularly in health-related fields. Why don't we get right to it? Andrew, good morning, sir.
Good morning, Josh. How are you?
Hey, very well. Thank you for joining us today. If you would, tell us a bit about yourself, a bit about your history, where you're from, and how you ended up here.
Sure. So I was born and raised in Savannah, Georgia, so Georgia native. I moved to Carrollton 17 years ago. My wife is a native of Carrollton and started a family here, have 4 kids, part of the community, love the city of Carrollton. And professionally, was working at Greenway Health and then started CareTrack 7 years ago. So it's a healthcare company, and we provide service to patients for physicians' practices. And we follow those patients between their office visits to keep them healthy.
Excellent. So, why don't we expand a bit on that? So CareTrack, as you mentioned, it's been in development now for 7 years. Could you take us through the process? What exactly does CareTrack do, not only for patients, but also for doctors?
Sure. So when you go to see your physician, we concentrate on patients that have chronic disease, and we concentrate on helping those patients stay healthier, but also we're looking for ways to reverse those diseases. But what we do is patients go see their doctor maybe 1 to 6 times a year. We follow them in between those appointments. So we act as an extension of the doctor's practice, and we stay in touch with those patients in the home, outside the office, to make sure that they understand what the physician has laid out in their care plans, and then also bring information back to the physician much earlier than they would normally find out about it to be able to react to changes in their health.
So it's like you're a representative for the patient and also for the doctor, on site constantly between these visits to make sure that everything is going along as it should be. Now, can we speak possibly to the incorporation of technology into this? Would there be potentially, diagnostic technologies which you would keep an eye on, beyond the, of course, implication of the, an online hub where you can communicate with the doctors and patients?
Yeah, so essentially we are a technology company. However, we've formed people, processes, and systems over the last 7 years to do this effectively. So our care staff, which we hire nurses, medical assistants, nursing assistants, and even some non-medical folks that I'd like to talk to you about, is that our technology allows them to be completely remote to provide this service. So the vast majority of the folks that work for us work out of our Carrollton office or either virtually. So it's all remote virtual work that we're doing on behalf of the physician to engage these patients. So it's calling them on the telephone. We have technology to engage patients. We can even send them a remote vitals device kit that they can take their blood pressure, weight, oxygen. There's a number of vitals that we track, and we can do that remotely and respond to them in real time as they need assistance.
What peace of mind that has to bring to families, not only of the patients, but to the physicians, the physician teams. They can constantly have an update, which would give them a much quicker response time in case a bit more of a an altogether medical procedure would be required to bring them in. Now, why? Why have you worked so hard these last 7 years to put CareTrack in the place that it is now?
As a country, we have an issue because we're aging as a population, and we don't have enough primary care and other specialty physicians to serve that aging population. So Medicare has an access issue to health care. And then secondly, costs are prohibitively growing exponentially for Medicare. So just theoretically as a taxpayer, we have to come up with better solutions to keep patients healthy because it's unsustainable at the current growth that Medicare is seeing. So where we work in that support structure is that we help reduce cost for Medicare and the patient while keeping them healthy and making the physician's life easier.
Perfect. Now this does, as you sort of explained here, it does do a service not only to the doctors but to patients. And you're here cutting costs. You're here keeping those lines of communication open. It seems that there's not much you can't handle in terms of keeping an eye on things. Now, you spoke a bit about ambitions to possibly find yourself in a place where we could perhaps reverse some of these diseases. What do we think the plan would be for that, like the goal, or perhaps?
Sure. So we offer a number of services that follow patients outside of the office. But effectively what our technology does is connect those remote services back to the physician's practice in a very elegant manner. So it makes it easy for physicians to incorporate these external services that follows the patients between appointments on a regular basis. So where CareTrack fits in is there are a number of programs that have been developed to treat disease categories or diagnosis categories. And one of them particular that we've recently signed is a partnership with Ornish Lifestyle Medicine that's owned by a company called ShareCare, very large publicly traded company, headquarters out of Atlanta. And what Ornish Lifestyle Medicine does is the only scientific program proven to reduce or reverse heart disease. So they're offering that virtually now. They've done it for years inside of brick and mortar, inside of hospital health systems, cardiology groups. Now they're offering this as a virtual program. So patients anywhere can sign up and participate. And we're supporting them in that effort to engage patients and engage the patient's physician, underlying physician. So we're really excited about that because there are a number of opportunities where we can go after particular disease categories. And the goal is not to prevent disease, but actually reverse disease when it does occur. So,
and heart disease, I believe it's if not one of the largest or one of the most infamous ways of dying. I mean, it's very, very common for folks to pass away from heart disease. So being able to cut that off at the pass and potentially reverse that's staggering. That's very exciting.
Yeah, I think I misspoke. It's not to treat disease, it's to reverse disease and prevent it. So
that's fantastic. Well, we're going to go ahead and take our first commercial break, but when we come back, we will continue our conversation with the CEO of CareTrack, Andrew Mills, as we chat about their growth over the last few months, as well as giving back to the community and mass hiring events very, very soon. So stay with us.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
I'm Michael Flynn, Oak Mountain Academy class of 1978.
Katie Flynn, class of 2010.
Justin Flynn, class of 2014.
Logan Flynn, class of 2019.
And I'm Marnie Flynn, current teacher at OMA.
My uncle Richard Orm Flynn, a founding father of Oak Mountain Academy, had a vision to see students become confident leaders who hold a faith-based value system in an academically rigorous environment. We are proud to celebrate 60 years of fulfilling my uncle's vision.
Our family invites you to visit the campus or oakmountain.us today.
And we're back to Community Voice. Today is July 19th, Tuesday, and I'm your host, Josh Engel. We're chatting with the CEO of CareTrack, Andrew Mills. We're also streaming live on our WLBB Facebook page. So if you have any questions or comments for our guest, I will be monitoring those and will be proud to read those out to Andrew. So if you're just tuning in, we have been chatting a bit about CareTrack, a very all-inclusive technology company that connects patients and doctors in an effort to slow down and hopefully reverse disease and keep a close eye on vitals and everything that goes into ensuring health. So let's chat a bit about the growth that you've experienced. You've mentioned that this has been a project that you and your team have been working on now for close to 7 years. So how different does today look than 7 years ago?
Well, I would say we're hitting our stride. I believe we're at 53 employees. I believe we've hired 7 in the last week and a half. So we're seeing exponential growth. So there's a large opportunity for us to employ West Georgians. We're hiring. We've got a new facility we've just moved into about a month ago. It's beautiful. We have 100 plus seats in our call center. So the folks that we hire are nurses, medical assistants, nursing assistants, and even those folks that are interested to move into that role. We offer a non-certified to certified training program.
An in-house training program.
Well, yeah. So we help them with their educational process through that. So if somebody's interested in moving into the medical field as a nursing assistant or medical assistant, we can help along that path with tuition reimbursement. So we're excited about that. But we need a lot of folks, and we'll need a lot of folks for the foreseeable future. So we have the facilities for that, and we're hiring constantly. So if somebody is interested, the typical person that comes and works for us is a clinician that has been in a clinical environment but is interested to transition to an office-based environment because it's all remote work over the phone and the use of a computer. So it's not the day-to-day hectic environment of a traditional clinical environment. But for people that are interested to still engage patients, that are interested in treating patients, it's an excellent environment, and we offer a lot of flexibility around working hours and even virtual work.
And great benefits, and I think that it's important to mention that I imagine there are a lot of medical professionals that are very burnt out after the last few years, and as you mentioned, this would give them an opportunity to still be able to interact with patients and serve and help, but it would be a big environment change that would probably be very beneficial for a lot of people. This is an opportunity to get on the ground floor of a dynamic new healthcare technology, and it's something that's growing quickly. So, do you have an idea about how many folks you're looking to hire? As far as growth is concerned?
Well, like I mentioned, we hired, I believe, 7 in the last week and a half. We see that pace continuing for the foreseeable future.
Excellent.
So, if you're interested in working in a remote care environment, we're interested to talk to you.
Perfect. So they can have information here. If you would like to get more information about that, definitely check out caretrack.com/careers. I'll repeat that there at the end of the program, but definitely look into this. This sounds like an exciting opportunity. Now, as far as this new facility goes, would folks that might want to look into the company or might want to apply, could they have an opportunity to see this new facility anytime in the near future?
Yeah, so we have a chamber open house September 8th.
Okay.
Come by. We'll have live music and catering, hopefully.
Excellent. So you can check out the new facilities, check out the call center, enjoy some live music, some finger foods, and have a good time. And
that's
I would imagine get a chance to talk with you.
Yeah, I'll be there. Our executive, everybody in the company will be there. So it'd be a good time to see the folks that you'd be working with and check out the facility.
And this is in Carrollton. Whereabouts in Carrollton, the new facility?
It's over. It's 590 Hayes Mill Road, so it's over near Tom Reeves and in the Carrollton City School System.
Perfect. So CareTrack has been an initiative now that has been it's 7 years in the making, but you spoke a bit earlier as to the why, and a lot of the why has been to serve not only doctors and patients, to cut costs, to save lives, essentially. I believe you're giving back to the community in other ways. You're working in ways to engage the community and make it a better place. Planting the seeds for what CareTrack will, I imagine, become in this neck of the woods. Could you speak a bit about the company's community service and efforts to give back?
Sure. So we've sponsored the Rafa Golf Tournament. Rafa helps the working poor, I guess is the best way to put it, for offering free medical care. Outstanding organization. Physicians and clinicians provide their time free of charge, but there's other costs that the organization needs to operate. So we've participated in that, and we're looking ways to expand our participation with Rafa. So we're excited about our community involvement with them.
Sure. What about that particular organization stood out to CareTrack? I mean, would it be of course, I imagine the medical connection certainly helps.
Sure. Well, there are a segment of the population that do not qualify for government assistance, yet are uninsured. And so folks that are working hard every day can't afford medical care. This is just an incredible thing that they offer for the community to support those folks.
Perfect. We're going to go ahead and take our second commercial break, but when we come back, we will continue our conversation with CEO of CareTrack, Andrew Mills. So stay with us.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
As a believer in the power of education, we are called to set the standard by shaping and empowering the minds of future generations through quality education. Oak Mountain Academy embraces this philosophy, which is why my children attend this prestigious school. I am elated to serve on the OMA Board of Trustees, where together we prepare students and remind them to trust and believe in the power to transform the world. I'm Dr. Brian Bain, inviting you to celebrate our 60-year legacy of academic excellence. Visit us at oakmountain.us.
And we're back to Community Voice. Today's July 19th, Tuesday, and I am your host, Josh Engel. We are live streaming currently on our WLBB Facebook page. So if you have any questions for myself or our guest today, the CEO of CareTrack, Andrew Mills, feel free to hop on the WLBB Facebook page and we'll get those questions and comments to Andrew. So, we've covered a lot of ground, but we've chatted about the growth, everything that's happened in the last 7 years. Where do we go from here, moving forward? What is the future for CareTrack? What are some goals that you're hoping to accomplish?
Well, we have a number of goals. Managing the growth is going to be fun. So just the opportunity for us in the marketplace is tremendous. So we see exponential growth for the foreseeable future, to continue to develop our product. And we see a number of opportunities to move into additional service lines that we currently are looking at moving into, and all that expands care for patients. So it's a more holistic set of services that we can offer a physician to care for their patients, reducing hospital readmissions, for example, these disease reversing service lines is really exciting for me. And the general technology to deliver those components. And what sits behind that is now developing the organization. So continuing to expand the leadership team. We're the founders of the company are pretty much the executive staff at this point. And so we're starting to move to bring in additional folks because we're just stretched too thin as an organization. And that's exciting and challenging at the same time. But we're looking for, I mentioned we're looking to hire clinicians, nurses, medical assistants, nursing assistants, but we're actually hiring across the board in many disciplines. So there's job opportunities that aren't healthcare specifically focused, but other areas of the business, human resources, sales, research and development. So there's a lot of opportunity at CareTrack, and we're really excited about that. We think it'll be a real shot in the arm for Carrollton and the West Georgia area.
Yeah, so, as we mentioned earlier, everyone is hiring, and there aren't many places that are hiring professional jobs, particularly in the medical field. I know a lot of available jobs around here in industry, and they're essential, of course. But I imagine that there are a lot of folks in the medical field that would like a change, and this is a brand new opportunity. This is a fresh start. So even if someone were, say, a physician, or perhaps technicians, X-rays and beyond, I mean, anyone that is in the medical field, it might be worth their at least sending their resume over, because there's no telling where the growth of CareTrack will end up. I mean, perhaps looking into Alzheimer's, dementia, cancer, I mean, all sorts of different fields.
Yeah, that's exactly right. In the list of careers or the job openings is ever expanding. So if you're interested in looking at CareTrack for job opportunity, just keep checking our careers page, because there's new job offerings that pop up every day.
Of course. And you did mention earlier that the new facility. Tell us again about this open house that's going to be going on, and maybe a bit more about the facility.
Sure. So open house is September 8th. It's right around lunchtime. And so the new facility, we have a 96-seat call center. Everybody gets an office, which is a change for us. We've been running pretty lean up until this point. It's a 14,000 square foot facility, so it's really going to help us accommodate our growth for the foreseeable future. We're really excited about it. So we were a lean startup to begin with, in very cramped quarters. So this is a luxury for us. So we're really excited about it, and we're coming back to the office post-pandemic. So we were completely virtual through the pandemic. So we're moving back to the new norm, and we're really excited about that. It helps with the camaraderie and the culture of the company, and we're blessed to have this facility.
Perfect. Now, as far as the listener at home that might be interested in finding out more about CareTrack, perhaps find out more about the process, how they could participate, especially if they meet the criteria, having a chronic illness. How could that person find out more? Is there who could they reach out to perhaps to learn more and chat more about CareTrack?
I would suggest they talk to their physician the next time they're in their physician's office. Ask them if they have a service that follows them between their regularly scheduled office visits, and tell them about CareTrack. We would love that.
Yeah, if they don't know, which they should probably already know, mention CareTrack.
Yeah, mention CareTrack. And if you're interested in the reversing heart disease program, you can go to ornish.com.
And that is Ornish, O-R-N-I-S-H?
That's correct.
Perfect. That was a guess there, and I was pretty close.
Yeah, that was good.
All right, Ornish. And that's something you plan to continue as well, partnerships with these state-of-the-art new programs that aren't being done anywhere else.
Yeah, we have a number of partnerships that are in process as we speak. So we'll continually roll these programs out. And the good thing for us is when those programs roll out and begin to scale up, we have to support those programs, and we need people to do that. So
Perfect.
appreciate you giving me the opportunity to let people know about it.
Yeah, great. I mean, I think this is, like you said, a shot in the arm to the local job market. I mean, the relationships I imagine that you are already in the process of developing with healthcare systems throughout the West Georgia, perhaps beyond. Is this something that's going to be primarily for Georgia, or is this something that might extend beyond?
Yeah, so the company is located in Carrollton, and most of the employees work in Carrollton, but we service currently anywhere in the United States in any territory. So we're nationwide currently, potentially have the opportunity to go international. So we're just beginning, really, as a company. So the growth potential is phenomenal.
So if you are tuning in at home and you have family that might be elsewhere in the country that might benefit from something like CareTrack, would you recommend they send them a link to this program, or maybe send them a link to the website?
They can send them a
Both,
link to the
actually.
web. Yeah, both actually. And typically we have, give you an example, we have patients that are elderly and they have a caregiver that doesn't live in the same city that the patient lives in. So they may have a child or a relative that we engage with CareTrack to keep the caregiver informed about the condition of their loved one in a distant city. And that's pretty common, actually. And so caregivers find that extremely valuable.
They have that constant eye to make sure that their loved one is fine.
That's right.
Well, Andrew, I really appreciate you taking the time to come on the program today. To learn more, visit caretrack.com. If you are working in the medical field currently and would like a change, opportunity to work in an environment like this, just go to caretrack.com/careers. Andrew, again, thank you so much, sir.
Thanks, Josh.
And thank you for all of you tuning in at home. We'll see you next time.